My name is Dr. Neil Baum. I'm a urologist in New Orleans, Louisiana, and I would like to take a few moments to explain the technique of self-catheterization for men. In this 3 to 5 minute video, I will describe the purpose of self-catheterization, how to perform the procedure, and when to call the doctor if there are problems with the catheterization. So what is the purpose of self-catheterization? It is for men who are unable to empty the bladder, or they have a bladder that does not squeeze or contract, allowing the fluid to exit the body. Also, it is a situation that can be used when people have a temporary difficulty emptying the bladder, and they don't want to wear a permanent catheter and all the accompanying complications associated with the use of a permanent indwelling catheter. The procedure is quite simple. It can be done by almost any men. It may be temporary, or it may become part of your regular routine. Now, what will you need? You will need a clean catheter. This catheter is designed specifically for men. It usually contains a water-soluble lubricant or jelly that allows easy insertion. You will need soap and water. You will need a toilet or a container to collect the urine, and you will need a clean, dry storage container, usually a plastic bag. So let's talk about getting started. Begin by washing your hands, washing the penis and the skin with soapy water. Get very comfortable, lubricate the end of the catheter, and place the other end of the catheter over the toilet bowl. You then grip the tip of the penis, stretch the penis out over your stomach, and insert the catheter slowly until urine starts to flow. Urine will begin to flow, allowing the bladder to empty of its contents on the inside. When the urine stops flowing, it is time to remove the catheter, wash the catheter with soap and water, and then store the catheter in a plastic bag. There is some circumstances when you will need to contact your physician. If there is little or no urine coming out of the catheter, if the urine that comes out is bloody or dark tinged, if the urine is foul smelling, if there is urine leakage between catheterization, if there is severe pain and discomfort with the insertion of the catheter, if there is pain in your back, or if there is fever greater than 101 degrees. In summary, an intermittent catheterization is an effective means of emptying the bladder. It is easily accomplished by most men. There are few complications associated with the technique of self-intermittent catheterization. And for the most part, intermittent catheterization is far better than a permanent catheter with a leg bag. I know you may have some additional questions regarding intermittent catheterization. If you do, kindly contact my office at 504-891-8454 or go to my website, www.neilbaum.com. Also, at the end of this video, if you have any additional questions, please open the door and I will return to the room shortly to answer any additional questions that you may have. Thank you.